Welcome, everybody, to another Good Gut Live. I'm very excited to be here. And if you haven't joined us before, my name is James Marin. I'm an integrative registered dietitian, one of the co founders of Married to Health, one of the hosts here on the Good Gut Live podcast. And thank you so much for those watching live. We can see your comments, we can chat with you, we can answer your questions. If you're watching this later on the Good Gut Live podcast, thank you so much for watching and listening and just being here. We're excited. We've been doing a lot, and I'm gonna give a nice overview. We're going to get into what we presented to, I think it was actually more than 800. I got to get the actual number, but a lot of doctors, dietitians, nurses, health coaches. We spoke at some amazing conferences. So shout out to the Plant-Based Nutrition and Healthcare Conference, which is now the Power of the Plate. And I'm going to pull some of that up. Yeah. Because they just change their name. So this is really a movement of broadening the idea of how we can all play a role in ending chronic disease and what we like to call heal with each meal. That's our tagline. That is in the most simplest way that we explain what we do here at Married to Health. We help you, we help your family, we help anyone heal with each meal. So the what has been known as the Plant-Based Nutrition and Healthcare Conference is now the Power of the Plate Conference, I guess you could say. But the link will be down below. And for those listening later, you can click any of our links at Married to Health, and whether that's on Instagram, YouTube, all of that, but I'll try to pull it up as I'm here. So we're excited. I'm going to give you the tidbits of it. If you want to get more, you can get the recording from the conference. Yeah, here we go. I'm going to pull it up right now. For those watching, you can see this, but this is like brand new, just yesterday. Power of the Plate Conference, and it is coming up next year, May 14th through 17th. So check that out. We're gonna have the link and the Power of the Plate Conference shout out because it's just great information. It's broadening. So if you're a city planner, if you're a nurse, if you're a doctor, if you're like even beyond those in healthcare, we want you to be there. We want you to learn and understand, and really health can be in everything. There is a health in all concept that is super important and super powerful. And so what I'm going to share is what we presented this year in 2025. If you're listening later, it's still very relevant. But for those live, obviously it's still 2025, but it is insane how it's almost 2026. That is pretty wild. Hope you're all ending 2025 on a good note, or let us know if it's not. Are you struggling? Many of our patients are struggling with gut issues. That is still majority of what we see as our patients, right? They're struggling with IBS, which is doctor speak for I don't know. I don't know why your gut's inflamed. And it's cool because we're working on a post right now that that was inspired by another post we saw. But it's this idea that oral inflammation, right, is gingivitis. And then when that inflammation goes into your esophagus, that's esophagitis. And when that goes into your stomach, the doctors will call it gastritis. You have gastritis, right? Or we can even call it gastroparesis. And we have all these names, but really it is this dysbiosis. It's this chronic inflammation that is happening in different sections of our GI tract. And really, we are feeling more and more confident as more and more research comes out, as we speak to more and more health professionals personally or at conferences like this, and we present just really what we've been researching and the protocols we've been building for so long to these doctors and to just other health professionals. And we go, really, it's the gut everything connection. And for those that have been listening and following us for a long time, you've heard us say this, but we're going to get into some little tidbits here. I highly recommend you watch the entire talk and you watch all the talks there. They were really, really amazing. And Dr. Furman was there. I really like Dr. Furman's talk. There were some great talks this year, and I highly recommend you get the recording. You can still get that, and the link will be down below. So anyway, without further ado, I want to get into what we were kind of presenting because it really just breaks this down. But for, again, those of you that have been listening and watching and supporting, maybe you're a patient, maybe you're not, maybe you follow us, maybe you don't, whatever the case is, it's this idea of what we're seeing is massive, massive dysbiosis, right? And what that means, just to define that, that is just like dis-ease, right? It is an offset. It is not a balance. It is not eubiosis, which means a balanced biome, which means a balanced microbiome, which means a balanced population in the gut. It is an offset, right? It is a miss. And so really when we get into that dysbiosis, we are saying this biome, the active microbes and everyone in there is off. And so we see this, and I think it's easy for us to understand this when we think of ecosystems. So if you're a big nature lover like I am, I a lot of my free time is like watching nature videos. Like I love to do that to relax. I will watch whether it's people scuba diving and taking video and showing you all the kinds of animals. Fun fact: when I was a kid, I think of our daughter who's 10, and it's funny because she's saying what she wants to be when she grows up and what she wants to do. And when I was 10, I was like, I want to be a marine biologist. I was so fascinated with dolphins and like marine mammals and ocean and just aquatics. And I mean, so much of it was just so fascinating. And I did love to swim. And mind you, I didn't grow up like snorkeling or scuba diving or anything, but this was just like, this sounds really cool. I was watching the Crocodile Hunter and the Crap Brothers and all these shows on like Channel 28, right? What was KCET or whatever that we had here in SoCal, and watching all these nature shows, and I loved it, and I was just totally inspired. But all that to say, if you're a nature lover, you can understand the idea of like deforestation. You can understand the idea that in the macro nature, in the macro ecosystem, things can become off. And whether that, and really a lot of the time that's man-made, right? We're cutting down trees. We are, logging too much. We are fishing too much. We are polluting too much. And it creates this dysbiosis. It creates an ecological disaster. And so in the way we're doing that on the macro scale outside, we can do that on the micro scale inside. Likely you've heard us say that. So what does that all mean? Well, for us, what that translates into is like, I'm bloated all the time. I feel tired all the time. I have itchiness and eczema. So it can be histamine intolerance. We dive into the weeds of histamine issues and FODMAP issues and oxalate issues and sulfur issues. And so what that translates to is I can't eat nightshades and I can't eat fiber and I feel horrible when I eat nuts and seeds and beans and black beans and kidney beans. And so all of that can happen, and it's like, why is that happening now, right? And so what you're hearing out there, and you don't have to take our word for it, there's lots of studies and we'll get into some. Again, I won't go into like all the nitty-gritty studies. I don't know how interesting that'll be, but let us know. We can totally do that. And that's where I'd say get the recording if you want that. That's going to be where we get into the nitty-gritty. But what we are getting into is that the concept, and so important for you to understand, that we should not be running away from these foods. That really, if you're having these symptoms, if you're having these chronic GI symptoms and really chronic symptoms in general, it's trying to get to the root. It's leaning into that. It's understanding these symptoms and not demonizing and pointing fingers at foods, especially healthy foods like broccoli or garlic or onion. And yes, for a time, there can be a time where you maybe cut some of these foods out, but it's not long term. Okay. So maybe like, yeah, I know this stuff already. Okay. So the kind of way we've broken it down, and what I'll show you a little bit of tidbits from our presentation here. But let me pull this up. And I will kind of zoom in a bit, but I want to kind of see everything that's going on. So this is our title, the Plant Powered Nutrition Root Cause Support for IBS, SIBO, IMO, SIFO, and Gut Health. Now, keep in mind, we are presenting to doctors. We did get a compliment, which was one of the nicest compliments. And for those that are just listening, I will describe what we're seeing and everything. But we did get, before we continue, we did get one of the nicest compliments I'll say that we've ever received. We got a lot of compliments, but one that stood out was from a doctor, and he was like, that was the best overview of gut health I've ever heard. And so we really went through the story of like, hey, we went through Dahlia's story. So it was really cool to see kind of Dahlia's story really in depth and going, from a time she was a very young child to now finding out that, okay, I should be eating plants, but still struggling with that, right? We did, and I'll speak a little bit for Dahlia here, where there was a time where she did kind of have like imposter syndrome, right? Where she was like, oh, okay, I have IBS or I'm not feeling well, something's off. But everything I'm hearing and everything I'm researching is saying eat more fiber. Fiber is good for gut health, right? Plants are good for gut health. And I started doing that and I felt great. She started doing that and felt worse. And she kind of had this existential crisis. And this was, mind you, back, man, it was a while back, but you can see here, I'll pull up this slide where one thing we showed was that we went to this was probably like, yeah, in Dahlia's 20s, we went to one of the first plant-based nutrition and healthcare conferences just as dietitians attending. We're in this picture somewhere. Let's see if you can find us. For those just listening, I'm showing a picture at the plant-based nutrition and healthcare conference. And this is where dietitians, doctors from all over the world, we met doctors from Spain and I mean just all over Germany, right? So in the UK and Australia, and so everyone's there and learning, and so were we. But I remember Dahlia, really the insight here was I feel like an imposter because here I am saying eat more plants. Here I am at the plant-based nutrition healthcare conference. But when I'm eating more plants, I feel worse. I feel more bloated. I feel more constipated. Dahlia, I think we're pretty certain, like 99% certain, she had undiagnosed SIBO as well. She was distended, bloated, a mix of constipation, diarrhea, so much. She had thyroid issues. I mean, there's so much there with her autoimmune disease that likely stemmed from her poor gut health and so much there. So if and that's what we're finding. A lot of our patients that we see are the dahlias. Are the dahlias where like the simple tips don't always work. The simple tips work well for so many of like, hey, drink more water and eat more fiber and eat more Mediterranean or eat more plant-based and do that. And that's wonderful. But then there's also a subset where it's like, I can't do that. And so what we kind of showed here, and I'll kind of show so you see a lot. For those just listening, I'm kind of swiping through at the bottom a little bit, but what we show is kind of like this chasm, right? And so the average person is like eating only, I mean, really from the data and the stats that we have, the average person is not even getting the recommended fiber intake. They're actually below like 15 grams of fiber a day, where we should be somewhere between 25 and 35 grams, depending if you're a male or female. I even say it should be higher than that. We should be kind of in the ballpark of like 45 to 55 grams, um, which is a little bit more ideal of fiber. And so that's just from eating just really great plants. And so people aren't there. So this idea of like, wait, you want me to eat how many plants or wait, 30 plants per week or how much fiber, for those that like to count macros or looking at the grams, or for those where it's easier to just count plant foods. If you're starting from a point of like, I'm barely doing anything or my gut can't handle it, it feels like this. So picture I have is this guy standing on one side of the cliff looking at this huge gap and going on the other side. It's like eat more fiber and eat more plants. And so it sounds insane where it's like, you want me to jump? Like I'm gonna die, right? You want me to eat all that? I'm gonna die. And so that was Dahlia, where it was like, I'm going to die if I eat this. I'm not going to feel well. So really what we're presenting and what we've been doing over the years is developing. And so the next clip I'm showing is like building that bridge, right? So yes, you have to build a bridge. And everyone's bridge is going to be different. Everyone's bridge is, maybe some are going to be really big, robust bridges and they get built very quickly. Others, it's more of like, okay, we're able to send signals. We're throwing some pigeon mail, or we threw a rope over, and now we can rope across some things, and eventually we're gonna throw another rope, and it's a little bit more of a process. But we're building that bridge to saying you can eat more foods. You don't have to be stuck eating a carnivore diet. You don't have to be stuck eating only four types of foods, that are plants because that's all you can tolerate. You can actually eat in abundance. You can eat a diversity. And quite honestly, if you want to incorporate some high quality animal products, but you're able to still eat, you know, the artichoke and the broccoli and the Brussels sprouts and the microgreens and the beans, which are some of the healthiest foods you can eat. All the different colors of beans, the purples and the reds and the black, which is technically dark, dark purple. Right? So all those phytonutrients, you're getting those beautiful starches, the beautiful protein, beautiful, all encased in this beautiful fiber. It's amazing. And it is truly amazing for you. And so it is building that bridge. And so the other little tidbit where we so and just kind of break this down because we get so many patients, we get so many DMs of like, what can I do? I think I have SIBO. And really the short answer for that is like, you can work with us, you can work with someone who just understands it and knows and kind of can help you build this bridge piece by piece because I get it. And we know so many of you out there want us like, just build me the bridge already. Just can we just do it all in one go? Like, I just want to build this bridge and I get it. And for some of you, yeah, we can, it's a very tiny chasm. And it's like, oh yeah, this is simple. We can literally throw a bridge over and it's a rope bridge or whatever they call it, a drawstring bridge and a drawbridge, and it's boom, it's done. For some of you, it's like, man, we have patients who are like, I've been dealing with IBS for 40 years and my chasm is massive. And so we're going to need some air support and more equipment. And it's going to take some time to get that equipment, right? So it's kind of gearing up to then start this building process. But all is not lost, all hope is not lost, because really what we did was break it down into a restoration of what we're calling the four M's of gut health. And I don't think we've ever presented this outside of our practice. And so this is kind of a new way. And what you're seeing if you're watching are these M's and they're all connected. So there's really not a specific order. The big order, and you know what, I'm gonna try to get another graphic up, but the big order is what is tailored to you because what we tend to find is, and for those of you listening, for those of you watching, for any of our patients, is that some of these M's, I think this one might be, here we go. Okay, so some of these M's, you'll have more of an issue with than others. What are some examples? Okay, let's go into some examples. So the four M's, first and foremost. So the four M's of gut health are your microbes, your movement. Movement is just, I think, an easier word than motility, but those are one and the same. So your microbes, let's start there. We call that the microbiota, not the microbiome. That's the microbiota. The microbes are your population, right? All the little critters and crawlies, and it can be parasites. We are very vocal about educating you on parasites are commensal, meaning they're a natural part of your body. Yeah, you don't want to, I'm not saying go eat that raw, disgusting sushi and it's okay if it has parasites. No, no, no. What I'm saying is there are commensal parasites that actually can help you and be beneficial. Pretty crazy. But it's bacteria and fungi and protozoa and archaea. So you have trillions upon trillions upon trillions as more and more of us are understanding and realizing. So microbes pretty common now, I would say. Dolly likes to call them buggies, your good gut buggies. I like to call them microbes. It's one of the M's. Movement, okay, is the second M. And again, there's really no particular order. Again, it's the order that most is mostly affecting you. Second M is movement, your motility. Are you pooping? Are things moving, right? Are you having that gastroparesis? Is it all stuck in your stomach and you're burping and it's hurting your chest and you're getting the acid? You're burning your esophagus. And a big PSA is like, if you're having gut issues, we do want to resolve it sooner rather than later, of the mere fact of if we're trapping gases, if we're trapping too much acid, if we are continuing to irritate and inflame the gut lining, that is going to open you up for more risk of cancer cells. Anytime we're irritating, I mean, that's why when you stay in the sun too long, the sun is great, don't get me wrong. The sun is healthy for you. But if you stay in the sun too long and you burn yourself, you are irritating your skin, you are damaging your skin, and doing that over and over and over will lead to carcinomas, right? It's basically your cells are getting tired. And especially if your nutrition isn't on point and other things aren't on point, your body's like, I can't keep up. I can't make new skin cells fast enough. Well, guess what? Your gut contains modified skin cells. They're called modified epithelial cells. Your gut contains, we're going to get to the next M, I think mine as well. Your gut contains mucous membranes. So that's the third M, membranes that protect you. So these are modified epithelial, basically modified skin. You basically have gut skin. Let's call it that. Pretty cool. Okay, this program is not for you if you're looking for a quick fix and you're not willing to put in the work. We have spent years and years creating a program that actually helps you get to the root of gut dysbiosis like SIBO and IBS, but it is not for you if you're looking to get better in just 1 week and something very, very quick. We have made it simple, affordable, and go at your own pace, but you still will be the one putting in the work to get better and truly overcome your SIBO and IBS. Take advantage of the current sale price for the Good Gut SIBO IBS program because it will be ending soon. It's like an inside out tube that runs through your body, and it connects. If you think about the gut from mouth to anus, it's a tube that just is, it's one tube, but it's windy and twisty and it's in different areas, so it creates different ecosystems. Think how one river long enough, think of the Amazon River or the Colorado River or any huge river system. It's twisting and winding, and in different sections it'll have different ecosystems, right? In some sections crocodiles can survive, in some sections they can't. In some sections there's types of birds, and in others they can't because it's colder or warmer. These rivers are massive. So that's your body, where in some sections different things are going on than in other sections, right? And that is your gut. So the membranes are important. This is your mucosal membrane. This gets into leaky gut, or what's called gut hyperpermeability. You can degrade these membranes. You can break them down too much with all this inflammation, with all of this, again, chronic inflammation and irritation. You are degrading your membranes. Last but not least, the fourth M is the mind, and what's essentially called the gut-brain connection, right? So you probably heard of this. This is like, oh, your gut is known as your second brain, blah, blah, blah. You've heard this on podcasts. You've heard this. I feel like a lot of people are talking about this, but we have to understand, you see the arrows we have here. And for those that can't see, we have bidirectional arrows. Not only is it the gut brain connection, it's really the gut everything connection. And then all of these M's are cross, movements connected to mind, and membranes are connected to microbes are connected to mind, and microbes are connected to movement, and it can go all which ways. It's all connected. It's all this beautiful winning ecosystem. It's all connected, okay? However, you, our patients, whoever you know that is suffering with GI issues, you likely have one of these M's that is out of sorts more than others, okay? And so when it's out of sorts, just as an example, and I'm just, what's here on the page, bloating, excessive gas, malodorous gas, like you can clear a room with your gas, constipation, diarrhea, reflux, nausea, early satiety, food intolerances, food allergies. We're like, I'm sensitive. I took a food sensitivity test and I can't eat so many things. I can't eat chicken even. I can't eat beans, and I can't eat cashews, and I can't eat almonds. And this is where you're allergic to everything. We've talked on this so many times, but just really quickly, when it comes to membranes, when your membranes are degraded, when your membranes are not strong and healthy, you can have a leakiness, and really everything is leaking. Everything is leaking out. So all these food proteins that should not be leaking out are leaking out into your bloodstream and showing up on these food sensitivity tests. So very, very interesting and very, very important context. So yeah. So with that, now on the flip side, things can go Great. Things should be going great. If you're most like me, like I'll be honest, I travel sometimes. I've gotten food poisoning, and then I'm like, I can clear a room sometimes. I'm gonna be honest, and I'm gonna be vulnerable here. Okay, we're not. We're always in this up and down, right? Our ecosystem is constantly changing and moving. I would say more. The goal is more often than not, majority of the time, you're feeling great. You're asymptomatic, no symptoms, feeling great. Daily bowel movements, healthy gas. You can fart, you can pass gas. Dahlia knows I pass gas. Dahlia, we all pass gas. Who doesn't fart? Okay, if you're not farting, you have a problem as well. But so healthy amount of gas, no GI discomfort, right? So whether that's those sharp pains, the crouching over in pain, we don't want that. Balanced neurotransmitters, this even, I mean, that's a big one. I mean, because we want to really show the spectrum here, like even anxiety, depression, right? A lot of these neurotransmitters also are helping your gut lining, helping with your motility. Things are moving, right? So that's also coming from neurotransmitters being made in the gut. So much here, but really all this is like you're sleeping, you're pooping, you're not waking up in the middle of the night, either starving or having to poop. Your neurotransmitters are being made, your hormones are healthy, right? So for men, you're not having that erectile dysfunction. For women, you're not missing your period, or you're not in a severe and terrible menopause where you're having just horrible menopausal symptoms. All of that is related to these four M's. Really, I dare I say everything is related to these four M's, right? Everything is related to these four M's. It sounds pretty crazy to say, but I know a lot of doctors would agree. Pretty much everything is related to these four M's, which is wild, and I'll tell you why. Because the gut is where we are taking the outside world and putting it into us and putting it into our body. We're saying, hey, food, hey, liquids, even oxygen, even when we're talking to others, even when we're in an environment. So, the office I'm in, my home, my work, the gut, and obviously the lungs and the skin, yes, but the gut is where we are requiring our body to absorb, to truly be in connection and communion with the outside world. And not only just that, right? Not only be in connection with the outside world, but to then say, hey, outside world, you need to nourish us. You need to, hey, outside world, I need to get sustenance from you. I need to get nutrition from you and survive from you. Everything you eat, right, is either going to help you survive or not help you survive. Hence, heal with each meal. Is each piece of the outside world you're putting into you helping you to heal with each meal? And for many Americans and many across the world, the answer is no. And it's kind of like, yeah, which came first, the chicken or the egg? It's like if you've been eating ultra processed foods and things, maybe you're addicted to food, you have an emotional aspect of food. There's so many factors, right? Food addiction, emotions, food fear. You can also have just high stress. I mean, there's lots of antibiotics. There can be so many things that happened. So is it like the lifestyle and what you've been doing and eating that caused your GI symptoms? Were your GI symptoms already there and then this all of the other lifestyle factors made it worse? Yes and no. Yes and yes. No and no. Everyone's a little bit different, right? So it's like which came first, the chicken or the egg? Another thing we're seeing is, I mean, this can come from patients who are like, I do everything right. I eat plants and I'm healthy and I see my holistic doctor and I actually see one of you as my dietitian and I'm trying to do everything right. But you also come from a long line of your mother and your grandmother and your great grandmother who have IBS or Crohn's disease, right? That IBD or some other form of dysbiosis that can affect you from head to toe. And maybe you know it, maybe you don't know it. Maybe they knew it, maybe they didn't know it. That is transferred to you. That is passed on as well as what's called a transgenerational effect. So don't beat yourself up here. What I'm trying to say is we're breaking it down into these four M's for you. We're telling you that in each M can be your focus. Maybe one M is a little bit more significant than others. You can work on that and you can come out of this kind of pit. Whether you dug yourself into that pit whether your mom and grandma, great grandma, unfortunately dug you into that pit. And I do focus on the women there because with women, with vaginal delivery, with breastfeeding, with just even proximity to your mother and even just who you're growing up with, you're sharing in those microbes, right? So if mom, we're seeing that in studies, from how you're treated at a young age to how you are birthed and fed. I mean, the list goes on and on. That's a whole area called the exposome. It's going to shape your gut microbiome. It's going to shape your gut microbiome to have strong M's, like we said. I'm farting, but it's not clearing a room. I have healthy gas. I am not constipated, right? All these M's are strong, or at least, all these M's are getting a B plus. I'm passing. Like I may not be perfect, but I'm doing good. I'm passing. Or all these M's, right? Microbes, movement, membranes, and mind. All these M's, I'm getting a D minus. I'm getting an F. Oh, I'm failing. And again, it's not to say you're failing in particular, but these M's are struggling, right? You're struggling. You're having severe symptoms. You're not feeling well. And so the goal is like, how do I feel well? And we all have different motivations. Like, I want to feel well for my kids. I want to feel well for my husband or my significant other. I want to feel well for my job and my career. I want to feel well so I can fulfill God's purpose for me or whatever your calling is, right? If you don't feel well, it's very difficult to complete that calling. It's extremely difficult, if not impossible, to really reach a high potential, to really feel like, okay, I can do this. Because how do you focus when you're either having diarrhea all day, or how do you focus when you're hunched over, or how do you focus when you're having to take a sick day and or on disability, or you have food fear because everything you eat hurts you or hurts your body in some way. We're even talking about joint pain, and we're talking about even itchy scalp and allergies and heart palpitations, and you'd be surprised the symptoms that come from the gut. All this to say is we want you to fulfill your potential. We want you to feel good. And so these four M's are key. Now, let's get into a little bit here, and you can go back and listen to previous episodes. But what we want to do is go, okay, well, then what do I do? Well, there's a lot. There's a lot you can do, but to break it down simply is that there are specific protocols and diets. There are certain things you can do, and there's quite a few, I would say, roadmaps and pathways you can go down. But what I would say is everyone is unique. So you're unique to even your siblings, your brother, your sister, your mother, your father. You are unique, right? And so not every roadmap that someone else is taking is the roadmap that you're going to take. Not every diet that someone else is doing is the diet you're going to take. There are lots of gut powders and gut supplements out there, but hopefully this quick analogy will help you choose the right one. When it comes to gut supplements and gut powders, think of your gut as a garden. And in this garden, you can plant seed, you can transplant plants, or you can also facilitate healthy soil so things will naturally grow. What we opt for and what we recommend on a daily basis when it comes to taking a gut supplement is to opt for the supplement that will help the soil be healthy. This is essentially a compost for the gut. This helps ensure your gut soil is healthy, your microbiome is thriving with your own personalized fingerprint in your gut microbiome. If you're taking probiotics and not sure what they do, it's like transplanting plants that belong in tropical South America to Alaska. Sure, you can do it, you can spend money on it and time on it, but it won't last long. Instead, ensure that your soil in your gut, which is the gut structure and gut function that you uniquely have, is ready to facilitate healthy seeds, healthy probiotics coming from your environment, from your food, and so on. That is why we formulated Gut Nurture. It's very important to understand that this is customized. So it's based on proper testing. It's based on understanding what is going on and how things are factoring into what your needs are. I guess I'm going to show, for those listening, I will describe it. Just another little tidbit. of kind of what we're doing here. So you've heard of low FODMAP, low histamine, low sulfur, and even the low fermentation diet. What does this all mean? These are all just components of food, and FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, polyols. Quite the mouthful. That's why they made it in the acronym. FODMAP is an acronym, right? And that's what that means. So you're kind of temporarily eliminating some of these foods in order to reduce some of the inflammation. You're helping those four M's. You're not just eliminating these foods, taking an antibiotic, and going, all right, I'm fixed. No, we're going, what led you here? Why are you having various types of inflammation throughout your gut? Why are you feeling these symptoms all the time? And some of these diets can be helpful, right? Because histamines and FODMAPs and sulfur and even just highly fermentable foods in general can irritate. If your gut isn't ready, these things will irritate. And another great example that I'll show, and what I'm showing here is a factory line. And so, what I want to show here is you can think of your gut like this complex factory line. And so, what I'm showing on the screen is a factory line, it's workers building, let's say right here, they're building tablets, right? And so you're having machines build and there's components. This is what your gut is doing. You're not just breaking down. Yeah, you're taking raw materials, breaking them down in order to make new materials. And guess who your workers are? It's your population. It's the M. It's one of the M's, your microbes. Your microbes are your population. They're your workers. They're going to help you not only break the pieces down, but also build them anew. And so this is the idea of prebiotics are the raw materials, right? Probiotics are the workers. They're like the really good workers, right? Probiotic, like you are employee of the month. You're killing it, right? And then postbiotics are what they're making. Hey, they took this metal and glass and steel and copper and and programming and chips and made a tablet. And now I can draw and surf the web and learn on the tablet. That's a great postbiotic, right? Wonderful. That's what's happening in a healthy factory. In an unhealthy factory, so what I'm showing here is just a fractured factory. So now, for whatever reason, the factory belt is worn out. One of the workers called out sick. So some of your healthy lactobacillus is gone because you're not eating fermented kimchi, you're not eating sauerkraut, you're not drinking kombucha. You're like, ooh, fermented foods gross me out. Or you're not being exposed in nature. You're not eating fresh and even cooked plant foods for so many reasons, right? You took a huge course of antibiotics. The list goes on and on. You were born C-section, they didn't swab you. You weren't breastfed. You weren't. All of these are real um, indications of how and what can happen and how your gut is going to be shaped. And therefore, in this analogy, your factory line, right? Some of our factory lines are amazing, and that's where you have the friend who's like, man, they eat a whole pizza and they're great. And then one day they're eating a salad and they're fine. They could have had a robust factory line passed on from even past generations where it's like, man, those belts are sturdy. They have lots of workers. Well, meanwhile, mine are on disability, right? We only have one worker and the line is long and I can't keep up and things are falling off and we're not making our quota. The list goes on and on, right? In this analogy. But one thing I want to point out is when this is happening, so if you look at this graphic for those watching, like I mentioned, all the different sections, and this is obviously it's an oversimplified version of the gut here, but all of these sections are important for your nutrients. This is how you get into trouble with nutrient depletion, right? With malnutrition, because in the stomach, for example, that's where we're going to absorb a lot of water and copper and iodine and molybdenum. And in the duodenum, we're going to absorb a lot of calcium, magnesium, and iron, and selenium. And most important is different parts of the small intestine. We're going to absorb our B12, which is so important, and vitamin D and vitamin A, like all the fat soluble vitamins at the end of the small intestine where we get our healthy gallbladder and pancreas helping us out. And oops, my gallbladder's gone. And oh, I have diabetes, my pancreas is sick. And I mean, you can see how it's all connected, guys. So as we inflame this gut, we are also inflaming not just the four M's, right? But even the way we absorb. So we are getting less and less of these important nutrients. We are creating an even more fractured and just messed up factory line, right? It's a mess. So I'm showing the messed up factory line, and it becomes a vicious cycle. Imagine this. Imagine this. How long has this been going on? Imagine your factory line has been messed up and fractured for days, weeks, months, years, decades. You get used to it, right? Your factory can still survive where they're like, I'm used to being understaffed like 10 to 1. I'm used to being low productivity, right? I don't have energy. I get, super exhausted. I'm on medication. I have to take 30 supplements. Um, I basically am addicted to caffeine. I rely on caffeine. I can't live without caffeine. So this becomes a norm, but that doesn't mean it's normal, right? This has become so many people, but in everyday life, but that doesn't mean that's the way it should be. And so this is really hard. If you're not ready for this, you're not ready for this. If you are ready for this, you're ready for this. And it's a lot of work to be like, hey, we're gonna have to revamp the factory a bit. And we could do it piece by piece. Hey, let's get some new workers in. That's helpful. But now some of the workers are standing around going like, there's nothing for me here. Bye, I'm going to a new job, right? So that's kind of the idea of like, I'm gonna take a lot of probiotics. Well, that's cool. That could be helpful. But if there's nothing for the probiotics to do and there's not good infrastructure, bye. You just wasted some of that money, right? So it's a combination. This is where we understand the four M's. What do you need to work on first? Maybe it's the infrastructure, it's the membranes. Let's work on that because now you have the tables and the conveyor belts and the equipment. And then along with that, we bring in the healthier population. Or what's really cool is there's a synergistic effect. So there's also something called symbiotics or a symbiotic effect where the foods you eat, who knew? Wow. Certain foods you eat can also come with their own microbes that like to eat those foods that help to rebuild multiple aspects of these M's. And at the same time, you're rebuilding the factory, you're also getting new workers. And now things start to move and work. This is a very simplified overview of what we presented. There's a lot of studies, and we got into case studies, and we got into the specifics, deep dive of these four M's as quickly as we could in the amount of time. We hope to be back. Dr. Stoll, we are talking with Dr. Scott Stoll, who's amazing. And again, click down below to learn more for 2026 and beyond. Where we need more time to make the foods and what you're eating, but the goal is that you're going to be progressing these four M's and to be adding on to these four M's, rebuilding even these four M's, and therefore getting the fruits of your labor properly, right? You're not having this malnutrition, you're not, having issues with absorption, you're not having all these symptoms, right? So hi everyone. Sorry, I was on a roll there. I'm seeing everyone on Instagram, great. And we're live on so many. I love simulcasting. It's so cool. But thank you all. Yeah, so that is version. If you want to learn more, you want to see the full talk as well as the other talks, click our link down below and get the recording. That would be great. And that would be super helpful just so you have it and you can watch it anytime. That was a little tidbit. So that was a big talk we did. We also did other talks. We had regenerative nutrition and gut health experience. If you want to learn more about that, when you go to our website, if you're on our website and you click on resources and you click on regenerative nutrition events, it'll give you more information. So we also had our third regenerative nutrition dinner. So it's technically the regenerative nutrition gut health experience. It was so fun. We had a wonderful time. And we are so excited to continue to do that. We also spoke at Thrive Alive, which was a really cool health and wellness festival in Kansas City. That was so fun. Layla was on a panel. We're going to be sharing photos from that a little bit more and sharing more in that. A very busy September, October. All of that was like September, October. We have one more speaking event before the holidays, and it's been pretty hectic. But I wanted to kind of give a rundown. Wanted to check in on just some really cool nuggets that we're sharing, some ways to help you understand your gut a little bit better, on ways to break this down because it can feel complex, it can feel overwhelming. It is, something we do say is that, look, if you're not ready to put in the work, no one's going to do the work for you, right? We can guide you, we can help you, we can give you the resources, but it's time to lean into the symptoms. It's time to dig deep into your root cause, not run away. We're not going to run away from symptoms. We're not going to run away from food. We're not going to run away using medications or supplements fully, right? Yes, medications and supplements are helpful, but they're not there to be a long-term crutch, right? You use crutches for a little while and then let them go. You want that, that's what your body can do, and that's what is definitely possible. All right, guys, that was good. Let us know if you want more. We can kind of do a part two to this. I know it's dense as always, but we love it. We love just connecting with all of you in a longer format, just sharing what we've been up to. We have some really cool episodes coming up on the Good Gut Live podcast, so make sure you are subscribed. Whether you're watching on YouTube, make sure you're following on Facebook, Instagram, and then again, thank you for listening to the Good Gut Live podcast. Follow there, comment, click our links to learn more, as well as leave us a review if you like. If this is helpful to you, getting insight in our private practice that we've been doing for several years with thousands of patients, practicing, integrative functional and even plant-based medical nutrition therapy. And again, we're not here to demonize any foods, let alone animal foods, but we have developed a way where you can eat plants, because really what's out there is a demonization of plants lately, and it's confounded, it's misguided, it's confusing, it's lacking context, and help you balance, again, help you feel with each meal and help you heal with each meal. So thank you all so much. Until next time, we'll catch you on another Good Gut Live. We'll catch you, on the podcast, in the recording, and connect with us at marriedhealth.com so you're on the email list. So you can join us in person for our events or any of our speaking gigs, or work with one of our 8 amazing registered dietitians one-on-one. And we'll see you at marriedhealth.com. Everybody, have a beautiful day. Have a beautiful weekend, whatever it is, whatever time it is for you. Be blessed, and we'll see you very soon. Bye, everyone.